Hi, I'm Robert Schnitzer. I'm one of the founders and the CEO of ROX Health, the Berlin-based venture builder of the Roche Group. And today it is my great pleasure to welcome Moritz, the global head of Roche Information Solutions. And Moritz, today we would like to learn about your perspective on why Roche is engaging in digital health and how Roche is engaging in digital health. So that's actually my first question.
Thank you, Robert, and thanks a lot for having me. It's always great and most of the time really great fun to engage with ROX. So why is Roche engaging with startups and actually with companies of all size for innovation? It's because we very firmly believe that innovation comes from all different angles, is anchored in diversity, and this diversity of ideas is not we cannot just foster that in our single organization. So we have an open approach, and we want to attract innovators that can come through very different paths. And we're building our solutions in a way that we provide platforms for innovations to then actually get access and impact on patients in the marketplace. And we have, according to that as well, different ways of engaging with us. So ROX Health is a venture builder, so that's typically the right place for very early organizations, or not even organizations yet, that want to drive innovations. We have with Creasphere another example that is more in the accelerator phase. So when structures are already a bit more built. And then we have, of course, as well, our partnering organization that allows then really more sophisticated forms of partnerships that as well are of larger scale typically.
Cool. And I mean, just an honest question. How satisfied are you with the setup? Is it working? What's the experience so far? We've been doing this for quite a while. So how effectively are we doing this?
I would say it works quite well, because not just do we see really great ideas flourish in these different models, we also have a number of very tangible examples where partners of the different stages are now really together with us in the marketplace, making impact on patient every single day. Just let me share a few examples. Some of the larger ones, I'd like to mention Smart for Diagnostics, who was in our accelerator program, who is helping with the pre-analytic process of sample collection and the safe transportation of samples to laboratories. And we have with CardioSignal an application that we deploy on an Android-based medical device that also measures hospital glucose. And so we're bringing this CardioSignal innovation directly bedside in the hands of nurses in the daily practice in the wards. Another few examples that are earlier on, I'd like to mention here Neotive, which came out of ROX as a very good example in the space of Alzheimer, early detection and therapy monitoring, which of course also is a very hot topic right now with new therapies being available. Patients need to be actually identified in order to be able to benefit from these therapies. And Halitus is another example, very, very early on innovation in an exciting space of breast analytics. So more to come in that space.
Cool. So third and last question I have for you today. Are there any specific areas that Roche is primarily interested in when collaborating with these startups and with external innovation groups?
There definitely are a few ones, but of course we also are looking particularly in areas where we might not have that much expertise, but believe that our platforms can actually extend in areas that other partners can complete and can actually bring in an offer that is complementary to our offer. But very specifically, the areas that we're looking constantly for partnerships is everything around the laboratory diagnostic space. I already mentioned here a few partners and this device. Navify sample tracking is one of the examples that we have here, which is an open ecosystem where we attract all kinds of service providers to handle sample transportation. The second area that we're particularly interested in is clinical decision support. As part of our core offering, and here in particular medical algorithms or clinical algorithms are of high interest, and we have a number of examples there that work successfully. And last but not least, the area of remote patient monitoring, where upcoming digital biomarker technologies are of particularly interest. And yeah, those are the three main areas that I'm sure any of our contact points will be always welcoming innovators with open arms.
Well, thank you very much, Moritz, for sharing your insights and taking the time today. That has been pretty insightful, and we trust this is also going to be some interesting information for those teams out there who are looking for partners and for working with a company like us, like Roche. Thank you very much.
Thank you, Robert. My pleasure.